Well, thank you very much, Tabiso. Yes, we are currently just outside the casualty unit of Livingstone Hospital here in Port Elizabeth. As you've mentioned, it was also earmarked as one of the quarantine sites, the first quarantine sites within the province. But we have had concerns since the 1st of June that the casualty and emergency unit was not cleaned. So some staffers, it came to a halt for them because they saw it dangerous, and uncalled for them to work in such an environment. But we do also had a statement from the health department on the matter. Just to update you, Tabisa, that the hospital indeed is not shut down. Light services are actually continuing, because we also took a walk inside the hospital and we saw that there is a queue just outside the casualty unit, and whereby there are still no visitations, as I spoke to one of the ladies there, just giving blankets and food to one of their loved ones within the hospital. But also another concern was that there are allegations that this also brought to a halt or kind of, it gave a little bit of a problem to cleaning staff, to kitchen staff, and as well as laundry services. So the catering within the hospital and the laundry department has also, ground to a halt, which are of course allegations at this moment. And just to further also tell you more on this, that this particular hospital has not had a permanent CEO since 2018, and the management committee since it was suspended. However, the health department is working on actually getting new management within the hospital since they were suspended. But however, we are not sure at this moment, the reasons why they were suspended in 2018 by the Superintendent General, Dr. Tobile Mbengashe. However, there are also posts that have been opened, close to 100 posts, for healthcare workers within this particular facility. And just before you came to us, Tabiso, what we also noticed was that there were ladies coming here as well, coming to submit their CVs. So indeed, it is a process that is currently unfolding to appoint more health workers within the hospital. And also the department is also in the process of appointing 9 doctors for COVID-19, because we understand at this very moment there are no COVID-19 doctors within this particular facility. But later on we will be chatting to someone from the unions representing the workers within this particular facility, just to tell us in some of the sentiments that they have heard from the workers after their meeting.
Lwando, what I'm picking up as well is that the dispute between the unions and management, as you've said as well, there's trickled down to some of the essential workers of the hospital. There are reports that linen has stopped being washed, leaving patients without proper bedding. But as you've just said, the hospital is not closed down. In short, the staff who are there are on go slow.
Yes, definitely. If we can put it that way, Tabiso, we could say they are on a go slow, because it's just light services running. It is. I wouldn't say it is fully operational. It's not business as usual due to this COVID-19. But there's also a tent just outside the hospital, which is for coronavirus screening and testing. As we've seen inside when we took a walk inside, we've seen that it is business as usual. There, people are going there to get screened. Some are going to get tested. So we don't see much of a hindrance within that particular division of the coronavirus screening and testing. But the side of the casualty unit and emergency unit is the one that is actually, receiving the problem. And we've also heard that recently that ambulances. There was an ambulance worker that was allegedly stabbed in Woma Township. So it was one of the concerns that some of the ambulances has also, because since we've arrived here, we haven't seen one ambulance actually in the particular hospital or arriving inside the hospital. So it is a concern for them that their lives are still at risk, as they've been also, crying on the issue of safety, that they should not be indeed, these criminal acts should not be taken by the community upon them.
With regards to COVID-19, we know the Eastern Cape has now overtaken Gauteng as the second province with the largest numbers. What is the mood? What is the feel? You are on the ground in the Eastern Cape. You've just mentioned that there's a lack of doctors in that particular hospital. It was designated as one of the quarantine sites or facilities and hospitals. What is the mood down there on the ground?
Well, we've had a few concerns from residents, especially when we went to the epicenter, the township that is the epicenter within this metro, which is Motherwell Township. When we arrived there and we spoke to some of the residents, some of them, they were reluctant of moving to level 3. Some of them were scared for their lives because they were saying that the health department has not assured them of their safety yet. Some of them are not yet well educated about the virus. Some of them in their community say they haven't seen any health workers since the beginning of lockdown, just to try and educate them or give them, protective equipment like a sanitizer or a mask to wear. So it is a concerning factor to some residents, although, there's been easing on the economy. Level 3 came with, a buzz within this metro. But the major concern is also, to some people, and especially the workers here in this casualty unit, is that since booze and alcohol sales are now back on sale, their concern is that the volume of people that will actually be admitted, due to accidents, due to crime, some were stabbings. So there is an element of concern in that particular regard, especially going into what we could call, say, the first weekend of level 3.
Lwando, just a correction on my side, it seems that Gauteng has overtaken the Eastern Cape, and as far as COVID-19 infections, that was just overnight. Overall, Lwando, we're going to keep an update with you, Lwando, and come back on that and double check on how proceedings are going. Confirmation, the hospital says they will be appointing staff. Hopefully, do we have a time frame? Because obviously this is urgent. You'd like to get all the medical practitioners, but first and foremost, before you even get them on board, you'd like to make sure that all the PPEs are available for them. At the top of the story, I spoke about simple things like gloves being missing. Those too must be a concern. What are the hospitals saying to that in particular? As you said, the meeting with the union should be coming up as well. Do you try and get a comment from them?
Yes, most definitely, Tabi. So the issue of PPEs has been an issue, day in, day out for health workers within the Nelson Mandela Bay Metro. And we've also heard that some health facilities within this particular district have not yet received PPEs, protective gear. So, which is still a concern for them, which also, because we do understand that they are close to, there's just over 70 members, health workers within this particular facility that worked in this particular hospital that have contracted COVID-19, which links back to the issue of PPE. Is there enough PPE given to them? Is it adequate enough to make sure that they are indeed protected in their line of work?
Lwando Nomoyi, as well as camera journalist, videographer, SABC Slengile, thank you very much indeed for joining us, coming to us live from Port Elizabeth there.